practice for 25 years, also the director of the Division of Geriatric Psychiatry for 11 years. She spearheaded the development of a 2-year geriatric subspecialty program at UBC and is now that program's director. She was president of the Canadian Academy of Geriatric Psychiatry when geriatric psychiatry was recognized as a subspecialty under the Royal College of Physicians and Surgeons. In 2010, Dr. Donnelly won a Killam Teaching Prize Award. Her focus today will be depression. During her presentation, she'll be introducing the couple with her, a patient and his wife, who will provide some personal experiences. So welcome to the three of them.
It's turned on. Can you hear me now? Okay. So I'm very grateful to be here because it's a lovely audience. And I'm hoping that we can introduce you to some serious problems with mental health and recognizing that, in fact, problems with depression can be very treatable. Now, I'm a geriatric psychiatrist and have been for 30 years, and about 50% of my patients suffer from some memory problems, but about 50% suffer from anxiety, grief, or depression. I'm not going to talk about memory problems, but after, if anyone has a personal question, please feel free to ask me. What I'm going to focus on is really depression. There is some feedback on this. I'm not sure if that can be changed. Is that? Okay, well, all right. That was going to help. So, unless it's painful. Painful to your ears, can I continue? Okay, all right. So, what I want to do is to tell you a little bit about, very little bit about some of the early symptoms of depression, and then I'm going to talk to Dawn and Nancy. Seniors, when they get depressed, are very similar to young adults. They may have some slight differences. The first symptom of depression often is an appetite disturbance and loss of weight. So we always look for that in our seniors coming in. Another symptom is early morning wakening an hour or 2 hours before you would normally wake up. Feeling lower energy is a symptom. Some of these things can be quite confusing, however, when you look at all the medical problems that people who are over 65 may have. So it can be a bit more difficult to sort things out. Some of the more serious symptoms of depression may involve things like feeling you wish your life was over, or even being suicidal. And I'm sorry to have to tell you that seniors are some of the highest completer suicides in the country. So it's a very serious problem that we have to be aware of and watch for. When people are very seriously depressed, they can also get into unreality kind of thinking. I had a patient, for instance, who the only thing she didn't do was she claimed a tax credit that she shouldn't have. She then got feeling very guilty that her son was going to be found out by the government that she had done this and he would be punished. And so she decided that life had no meaning and she should kill herself because her son would suffer the consequences. That's a very serious thing. So I'm going to introduce you to Dawn. Is it all right if I call you Dawn? And Nancy. And Dawn was my patient some years ago. When I'm listening to Penny talk about mental health and seniors, I want to ask Dawn a couple of questions to begin. And I will ask Nancy some questions too, because Nancy, as his wife, reflected on what Dawn was experiencing, and she experienced some of it too as his spouse. But Dawn, do you mind telling me how old you are now?
82 and a half.
82 and a half. And I think you're proud of that.
I said at 82, I feel better than I did at 81.
Yeah, okay. And listening to Penny and talking about mental health, when you were 50 and 60, how was your mental health?
At 50 and 60, I was on a huge and a career role. Everything was, I have had a fabulous career until retirement. And 50 and 60, if anything, I was a trifle overconfident. And that I had to pay the price for later. That was a problem early on, that my loss of confidence gave me a terrific kick in the pants, and I didn't handle it well at all. So 50, 60 was good.
What was the first thing that you remember noticing when you actually went from being healthy mentally to suffering some symptoms? What do you remember? What happened?
I think the very first thing was that I was stupidly isolating myself. Having moved to Vancouver, if I could just speak to that for a second, and retired, I didn't think much. First of all, my background's TV and production and administration. So when I came back from Asia, where I'd been for a number of years, like for example, I came from Dubai to here.
Sorry, excuse me. Please declare a tremendous problem here. Is there any way that we can go with the microphone that works that you guys can pass? Or maybe
Did you hear that?